January. And my name is Dilis Clare. I'm a GP, and may have met some of you before at a previous webinar, so it's nice that there might be new faces there as well. I went to medical school in University College Dublin. I went to a herbal medicine degree in Middlesex University, and I'm currently a clinical fellow of NUIG Medical School as I teach the medical students. I'm also a clinical teacher with Hartwood School of Herbal Medicine, and a member of the Irish Institute of Medical Herbalists, and I do various other educational ventures as well, as I have a real passion for education. So today's webinar is what do we need for respiratory illness, and that obviously involves the immune system. So we all know what it feels like. We're in bed, hot, fluey, feverish. People want to know what the difference between a cold and a flu is. If you've ever had the flu, you know the difference between a cold and a flu. A cold is something you can manage through, although best not to spread the viruses, and do all of the hand hygiene and disposing of tissues and everything in accordance with that. The flu, pretty much you're incapacitated. High fever, pain in joints and muscles, and really in need of care because it's just difficult to function. So a higher fever and much more generalized systemic illness. So the first thing we need when we have either a cold, and certainly if we have the flu, is we need a herbal tea and sympathy. A hot water bottle, somebody to tuck us in would also be very nice. But pretty much, I think we would all like the factor, you poor thing, can I make you a cup of tea? So that's the first thing. I think that's universal. Every medical system in the whole world would like us to be minded when we have cold or flu. So specifically, what herbal actions are we looking for, or from foods? And I'll mention some of those as well, as I'm teaching nutritionists. So the herbal actions that we want is, we want to promote the flow of mucus. We don't want to suppress the flow of mucus, because mucus is an excretory and protective system, and it does a great job contributing to keeping the airways clear and flowing. We want them to be made more liquid and more effective, rather than suppressing them. So we don't want to use decongestants that dry up our congestion, even though in another sense we would. That's absolutely not what's the best thing to do. We want anti-inflammatories, because sometimes inflammation is a healing response, as you all know, but if it's too intense and creates too much congestion, so that blood and oxygen and medicinal constituents can't flow, and your vitamin C and ginger and all of those things can't actually get into the tissues, well, you want to, a bit like the fever, you don't want it to be too overwhelming, but you don't want to suppress it, but you want to make it more manageable so that it's effective. Obviously, we would like antiviral and antibacterial actions. Most colds and flus are caused by viruses, or all of them, but what they do is they leave the door open for secondary bacterial infection. And that's what causes the pneumonia and the severe bronchitis and the severe acute sinusitis. So we want immune modulation. Immune modulation is it's more than just stimulating or suppressing. You want the right level of immune, increasing immune function to suit the illness. So if there's bacteria and viruses to overcome, you want to stimulate the immune system. Is probably but you particularly want to stimulate the innate immune system, which is the macrophages and scavengers, because that's what leads to the excretion of all the gunk. So there's particular aspects of immune system you might want to stimulate. Diaphoretic is a sweating effect, because sweating freely means that you keep the fever effective but also manageable. And it also is an excretory system, and you want to, with any acute illness, you want to facilitate elimination. So having a bit of soft stools while you have an acute illness is not something, again, to suppress. It doesn't usually happen with colds or flus, but it does for some people. Soothing mucous membranes, I mean, particularly with something like a harsh, croupy, barky, or whooping cough, and adults can get whooping cough. You want to soothe the mucous membranes, and you want to have a restorative, nutritive effect for the mucous membranes. So some herbs are particularly what we call tropho-restorative for mucous membranes. So that would be another good action. We want to use adaptogens because people get sick because they're under stress. So we want to use an adaptogen that might have a particular immune impact. So of the range of adaptogens, you're choosing one which is more suitable for the immune system. Circulatory stimulation, again, it's a gentle effect that we're looking for. I'm thinking of ginger as I speak. So a circulatory stimulant so that the herbs get into the affected tissues would be a very good idea. An antifungal effect, and particularly with chronic sinusitis or acute on chronic sinusitis, there's emerging evidence that it's quite likely that a stronger case is being made that there's a background fungal infection, which won't be much of a surprise to nutritionists, I guess. The nervine is most people when they are becoming vulnerable to infection, it's because they've been under stress, either environmental stress or work stress, not enough sleep stress, all of those things. Analgesic effect would be good, particularly for sinusitis and flu, and antispasmodic, and the obvious one of that would be sneezing. So in addition to all of these herbal effects, we also encourage rest, warmth, fluids, vitamin C, zinc, etc., that you'll be advising them about, and a good dose of sympathy. I'll briefly mention the traditional cold and flu tea. This is a cold and flu tea that will be recognizable throughout Europe. If I go to herb fairs in anywhere from Bosnia to Poland, I'll find that there'll be slight variations apart from these, but these would be core for using for cold and flu. And it's yarrow, elderflowers and elderberries and mint. And I would substitute catmint for children. So the overall effect of this tea would be a diaphoretic, antiviral, gentle decongestant, as with the mint. The mint is a clearing decongestant through the essential oils, but it wouldn't be like a chemical constituent decongestant, and antispasmodic. So you would drink this 3 teaspoons a day, 3 to 6. If I had flu, I'd be downing 6 teaspoons a day. Herbalists always ask the question, why now? Whatever patient we have in front of us, we're going, why are they coming to see me now at this point in their life? They may have had IBS or acute on chronic sinusitis for 15 years. So why are they coming now? Is always generally a very good question. I'm sure you find the same thing. But why are they getting sick with a chest or immune or respiratory problem now? And there is usually a number of contributing factors, and these are just some of them, and others will be unique to different patients. We'll work clockwise from 1 o'clock, where this gentleman is coughing and blowing out his cheeks, which can represent bronchitis, chronic bronchitis or emphysema. They get chest infections as a flare-up because of the vulnerability of the altered structures. Going down to 3 o'clock, with somebody putting their sneakers on, and overtraining, undertraining are 2 different things. People can pick up bugs and in showers and changing rooms. But I find that people who do ultra marathons, very extreme exercise, women who exercise to the point of not having periods, for instance, would be at risk of immune difficulties.
Sorry, Dilis, can we go into Zoom for a minute, because some people saying they're not seeing you. I want to make sure that we have everybody.
Oh, they don't know what they're missing. Okay. Hello, everybody.
Okay.
So, hello,
Apologies
Rebecca.
to anybody who is waiting there.
Caroline,
it's
Larissa.
Our second webinar, so
hi, everybody.
Getting used to all of this. There you go.
Oh, lots of people.
Yeah. Hi, everybody. Sorry, Dilis, to interrupt you there.
It's fine. Much more important that everybody is included.
Oh,
okay.
Go back to where you were. Yep.
Okay. Gosh, where was I?
Sorry, Dilis.
Where was I? Oh, yeah, here we go. For those of you who haven't been here, I've been saying what my qualifications are. I'm a GP and a medical herbalist, and we all want tea and sympathy, the difference between a cold and a flu. Many of you will know that anyway. And what are the actions of herbs that we might be looking for? Maybe I'll do that one again. Yeah, so the actions are to promote the flow of mucus, anti-inflammatory, antiviral, antibacterial, immune modulation, to stimulate it or suppress it if it's overreacting. Diaphoretic is sweating to manage the fever, soothe the mucous membranes, restore and nutrition for mucous membranes, choosing adaptogens for stress that are more immune influencing, circulatory stimulation, things like ginger to get all the herbs and the goodies into the inflamed area, antifungal, particularly for chronic or acute on chronic sinusitis, nervines because people are often stressed before an illness, analgesics, particularly for sinuses and flu, and antispasmodic, and rest, warmth, fluids, etc., etc. There's a cold tea, yarrow, elderflower, and mint, which cools a fever by sweating, antiviral, a natural decongestant, and antispasmodic. And this is where we're joining in. Going from 1 o'clock, this gentleman has underlying or represents having underlying bronchitis or emphysema with acute infection. And then the person tying up the shoelaces might be over-exercising or doing extreme exercise. And certainly women who are exercising to the point of not having periods, they would be experiencing stress on the immune system. This is more your department at 5 o'clock. This is probably an average mixture of a bit of good and a bit of bad, but or unhelpful and helpful. And people may well have had poor dietary contributions. Many of us work in schools and offices and places where there are large combinations of people in one space. Too many people are missing out on sleep. This chap here at 7 o'clock is socially isolated by the looks of things, and is doing his Facebook or whatever in bed when he should be sleeping. So sleep is very important for the immune system. The seasons of the month, seasons of the year, winter is obviously cold and flu season, hence the trolley crisis in casualty. And getting drenched or getting frozen with the cold can be a stress on the immune system. So your granny was right. That you'll perish with the cold and come in and warm and change your clothes and have a hot bath. So, okay, so I'm actually speaking to you at a time of change in our practice and the formulations. We have a range of products that are useful for people for both the chest and sinus mix, and that's the one that I'm primarily dealing with today, particularly because it's a bit complicated because we have an existing formula and we've reformulated for a variety of reasons. So people who have used our chest and sinus mix up until now will have been and are currently using astragalus, echinacea, elderflower, garlic, mallow, sage, and thyme. And it comes in a bottle like this. We've changed it and rebranded it as a new product as Mucotone. And there is some overlap. There's thyme, licorice, garlic, Panax ginseng, Icelandic moss, cat's claw, mallow root, echinacea, and ginger. So I'll just give you the story behind why some of these herbs are useful. And the reason why I'm firmly entrenched in traditional herbal medicine as opposed to constituent science and the limited amount of clinical research that there is. And if we look at sage and thyme, we now know that they have antibacterial, antisepsis, antifungal effects, but they didn't know that back in the medieval times when people had no fridges, obviously, and they would have killed their lamb on a Monday and would still be eating it on Wednesday. So what they would do with the food that they needed to store is they would wrap it in sage and thyme, and lo and behold, over a period of time, I don't know how long, this knowledge would have been gathered and passed down, and it would have been just what people did because their parents had done it before, just like us. And that's why sage and thyme would have originally been used with food, and the same with horseradish with beef. It's to do with understanding the digestive function empirically through observation over long periods of time, and fennel with fish, and for an awful lot of spices in general, such as turmeric. So the incidence of, at a time when there was no ensuite toilets, so if you did get the runs, you were out in the ditch in the middle of the night, wherever the trench was dug, and you also didn't have hospitals with IV fluids for the very severe cases. So you can imagine how important this knowledge and information was. And there's further evidence that we actually co-evolved, so that we no longer made these antiseptic, antiviral constituents because they were abundant in the plants all around us. So we gradually learned to rely on taking these special plants at a time when we were challenged by particular illnesses or affected by particular illnesses. But these would have been entirely preventive. And this is the first piece of research that I'm quoting for you, where thyme was been shown shows antimicrobial activity in different extract amounts against 4 common bacterial strains and 2 types of fungal infestation with candida. And it provides useful information on the use of thyme as a natural and economical antimicrobial in food preservation. All of these early societies found ways of storing food, like smoking it and salting it, and that's how people survived. So people were very clever and resourceful and resilient throughout the ages. Current research suggests that thyme has antimicrobial activity and modest antibacterial effects. It also seems to have antiviral activity against influenza A and respiratory syncytial virus. The respiratory syncytial virus is responsible for an awful lot of the upper respiratory tract infections. It also has antifungal effects and has antispasmodic, antiplatelet, anti-inflammatory and anti-allergy activity. And these references are taken from the Natural Medicines database. There was just too many going through it to literally list all of this research. And most of it is in vitro. So it's of limited clinical influence anyway, but it's certainly put together with the medieval story and the current research. It creates a credible viewpoint where you would want to prove that it didn't work rather than it did work and be effective. This is one of the pictures of thyme. There's another few here. It's quite a varied plant. If any of you go to the Aran Islands, you'll see it growing on the rocks. It'll grow in your garden. It adapts to many different habitats. It grows throughout the winter, which is when we need it, which is quite nice. So it's a good plant to put in your garden, or to advise your patients to put in their garden. And this is a piece of research on a formula of thyme and cowslip, which is called bronchipret, 3 times a day. And this study compared bronchipret with synthetic drugs. Now, I'm not sure if that included antibacterials, antibiotics. Or just over the counter, but there was a tendency for better results with bronchipret, particularly for adults, and similarly with adverse effects, there was benefits in using bronchipret. So the conclusion is that it implies that the risk-benefit evaluation would favor bronchipret over synthetic drugs for acute bronchitis. And this is the research reference.
Excuse me, Dilis. Sorry, are we supposed to be seeing slides here?
I would think so. Hold on, my able assistant.
We don't seem to be seeing anything that you're doing. Sorry for interrupting.
No, thank you. Have any of you been seeing slides?
No, not at all.
No, I haven't, no.
Oh my
Sorry.
goodness. We'll send them to
Sorry,
you
guys.
afterwards anyway. But it's all in the storytelling. So afterwards we'll send you the slides in any case.
I see them now, actually.
Okay.
Thanks for that, whoever that was.
Thank you, Mary Margaret.
No problem.
Is that it?
Yeah, thank you.
Okay. I hope you've all been able to follow. I mean, I've pretty much been describing what's on the slides. So maybe at the end, you can go back and look through the slides, which is probably a great way of revising it anyway. But I won't hold you all up. I don't mind doing them all again, but I won't hold you guys up because I'm sure you want to get on with your evening as well. So I think so long as you have the resources afterwards, we'll be fine. So you've all got a nice pretty picture of Echinacea now, I hope. Okay. It's nice to talk to somebody anyway. I can picture at least one person out there now.
Sorry.
Okay.
Sorry.
I have a tech assistant here who's also a nutritionist.
Do another thing. That's it. Legit.
Okay.
If you want to move that out.
This one here. Okay. Okay, so I hope you have a nice pretty picture of Echinacea. They are rather spectacular. You can put them in a border. You can buy the rootstock very easily and you can put them in a border. But I'll show you that there's the thyme. So it'll grow nicely in a pot or on a window box. Very nice to be able to go snip a bit off, especially if you don't have any of these preparations in the cupboard handily. And you just put a sprig off a teaspoon and put them in the teapot, and that's another example there. And that's the research that I was talking about. So Echinacea, I need to be able to, oh, here we go. No, we're fine. Yeah. So taking Echinacea modestly reduces symptom severity and duration by about 20 to 30% for the common cold. Echinacea is most effective started when symptoms are first noted and continued for 7 to 10 days. It seems to be safe when used orally for short term and lasting up to 12 weeks. I have to say that as a herbalist, we use Echinacea as an alterative. And an alterative is something which restores the blood to its usual level of congestion, if you like, by and if the blood is too congested, it stimulates various eliminatory processes. But the modern science story is that it supports the immune system, particular areas of phagocytosis and white cells and whatever. So my money is on the traditional use, to be honest, but it's nice to have the science as well. I think science is a very nice another angle. Because by the time we've used herbs for thousands of years, we're pretty cool on a lot of the actions and reactions, but it's nice when they're validated, and most of them are by the science studies. I do take care with Echinacea with people, and especially children who are highly atopic. It's one of the Compositae family. It's called the umbrella family, and you can see from the petals, in keeping with sunflowers is the other. So sunflower seeds can sometimes cause allergies as well, because it's part of this family. There's preliminary evidence of safety in pregnancy, so don't panic if somebody is pregnant. But with all herbs during pregnancy, it's just a little note: we avoid everything unless there is less risks compared to the benefits, and otherwise they might need to take a drug which would have more risks than benefits than the herbs, if you get what I mean. So we weigh up a risk-benefit analysis specific to pregnancy and specific to what the other probabilities are if they weren't to use the herbs, and how likely the herb is to ameliorate the condition. So, and that I left that in just so that it was a general way of describing our use of herbs in pregnancy. And the science shows that another aspect of herbal medicine, and I'm using this as an example, is that Echinacea inhibits intestinal CYP3A4 and induces hepatic CYP3A4 enzymes. And this is a good example of more and more science is throwing up these various CYP enzymes as though they're the oracle, particularly in the liver, and quoting them as potential interactions with this, that, and the other, and care with this, and care with that, and care with the other. But in fact, these enzymes are much more complex than you might think they're produced in different tissues, and the same herb can have different effects on different tissues. And because the herbs are multi-constituent, you can have one constituent that stimulates CYP3A4 even in the liver, and another that inhibits it. So you want to make sure that if you're reading research, that the research is on the whole herb, because an extract of constituents might be having a not balanced, giving a not balanced picture. So again, in choosing what to put in a 45-minute webinar, it was kind of like I was trying to pick out things that you might not find in another source. And I'm trying to knit things together so that you have ways of thinking about herbs and what's suitable for you to treat or manage, and what you might need help with. All immune herbs that have an effect on the immune system, you need to use with caution or with interpretation with immunosuppressant therapy. But I don't think you'll be treating patients on immunosuppressant therapy with herbs that influence the immune system. Garlic is well entrenched in your home territory. We use the garlic bulb. It's lowers fats in the blood. It lowers high fats in the blood, I should say. It helps with blood pressure. It's antifungal. However, there's also evidence that it's antibacterial, antihelminthic, which is the worms, antiviral, antispasmodic, promotes sweating. And I think we'd all kind of vouch for that, with or without a science study, and an expectorant, immunostimulant, and antithrombotic effects. Many of the pharmacological effects of garlic are attributed to the allicin and other organosulfur constituents. So people need to be able to metabolize the sulfur. And some people, garlic actually makes them nauseous and ill, and it's quite likely that they're poor sulfur metabolizers. Garlic also seems to have humoral and cellular immunostimulant activity. So it affects both the initial phagocytes and mopper-uppers and the more learned immune response. Antiviral, including particular evidence for the parainfluenza virus. And one study on the common cold, research showed that it might reduce the frequency and number of colds when taken prophylactically. So over to you guys, lots of garlic in the diet. In an era of Lyme, I thought this reference was interesting. People who consume high doses of garlic over a 20-week period seem to have a reduced number of tick bites when compared to controls. The EPA and concurrent use of garlic can theoretically enhance antithrombotic effects. So you just need to be aware of that. And that's really if they're taking supplement levels of EPA or fish oils. And if you're taking a high level of EPA and a very strong garlic supplement, I don't think it's a problem with food levels, but again, just to be aware. So there are interactions with anticoagulant and antiplatelet drugs. And also, this is so common now with these theoretical writs with the cytochrome P450-2EA, E1 substrates. And care should also be taken with cancer drugs, HIV, etc. Now, these aren't a risk if you're just taking garlic in the diet. And even in the blend that we use, it's 20 mils in 1 week, which is in keeping with the food amount, so long as that's not used in addition to a garlic supplement. I put this in because it's an overall review of garlic and health and disease, and I thought you might like to check it out. It just was particularly relevant for you. Mallow. Now, if any of you are familiar with how I work, I use enormous amounts of slippery elm, and slippery elm is under sustainability pressures because it's become so popular, because IBS has been so common. And now I use the slippery elm along with marshmallow root as a powder, and they're both together. Marshmallow leaf and slippery elm are mucilaginous. So if any of you have used if any of you eat porridge, you'll know what mucilage is. And if you've mixed slippery elm, you'll know how slippery and slimy it is. And mallow is probably somewhere between the two. And it lines the gastric mucosa. Anything that lines the gastric mucosa will have a reflex from the spine, a reflex arc, relaxing effect on the lungs. So mallow and mucilage are very good. There's further research shows that the mucilage polysaccharides soothe and protect the mucous membrane from local irritation. The mucilage inhibits the mucociliary transport, stimulates phagocytosis, suppresses cough, increases the anti-inflammatory effects of topical dexamethasone, can have hypoglycemic activity, and I'll speak about that in a minute. The mucilage can also have antimicrobial, spasmolytic, anti-secretory, diuretic. Why do we need anything else? Obviously, it's perfect. And wound healing. And I do, again, use it as a poultice with the slippery elm for wound healing. So it's very safe, very soothing, very nutritious, and has all of these effects. So that's what it looks like. It's a very pretty flower, lovely one to grow in the garden. And those leaves, I nearly feel like touching them on the screen. They're soft and feathery, not feathery, soft and a bit like lamb's ears, if any of you are gardeners, like that downy cotton wool kind of feeling, actually very, very soft. And this picture I put in on the right, because if you can imagine, that's a waist-high fence. It gives you an idea as to the height. So it's a good perennial plant, very, very nice for the garden as an ornamental. My herb garden, I mix all these colourful herbs with vegetables, and you never know what you'll find in there. So they all go very nicely together. Cat's claw, or Uncaria tomentosa, has a lot going for it. And a review of the current state of affairs with Uncaria or cat's claw showed that the potential for the development of leads from cat's claw continues to grow, particularly with immune modulatory, inflammatory, and vascular related conditions. I love the way they put this, the development of leads. We've already had it. Nature has done all the development. All we need to do is put it in a tincture or a tea or a capsule and leave it alone. But of course, all of this scientific research is done by way of getting potential for future drugs, or even for developing very expensive processed supplements. So I'd like to think that Uncaria will grow and more in our area of knowledge around these areas, rather than we can commercially exploit it. But you know, that's just me. Given the diversity of constituents, and this plant seems to have about 35 to 50 constituents that are rare or unusual, and are certainly rare or unusual in the format that they're in. You know, that some constituents are very unlikely bedfellows in any one plant, but this plant seems to manage to keep them all within its leaves. So, and these are all some of the ingredients, glycosides, particularly effective against the rhinovirus, which is the cold virus in these cell lines. So that's in vitro. And then the cyanidins, catechins. So we have anti-inflammatory and antiviral activity. These support the suggestion that both forms of bioactivity, the anti-inflammatory and antiviral, are due to a combination of the active compounds. See, there was so many. I've tried not to overwhelm you with the research. I mean, there's you know, museums full of research, but I was trying to pick particular points that might be useful to you. And this is one, that the effect, even within one herb, is usually not down to one constituent or even two constituents. It's actually a blend of all of the ingredients as they dovetail, and the actions dovetail. You know, so one might weaken the cell wall and the other one would puncture it, of a bacteria or a virus. One might gobble up a particular exudate or toxin. Another, so they all the constituents work as a family, and some of them work synergistically. So it's not just 1 + 1 = 2. You get 1 + 1 = greater than 2. So that was the reason why I kind of put that particular detail in for that one. There's also antiviral activity. And another one that does contain alkaloids, increases phagocytosis and macrophages. This is actually an anti-cancer reference, blocking myeloid cell lines, which is a cancer cell line. But again, that's just to say that because cat's claw works for chest and sinus and the immune system, anything that works on the immune system will also have an anti-cancer effect. All the antioxidants will also have an anti-cancer free radical mopping up effect. But you probably know all that already. But the herbs are particularly complex, like food. Okay. I thought this was just interesting. 12 human volunteers took a capsule, 240 milligrams of cat's claw twice a day. And after, was it 20 days, they had enhanced DNA repair. And that was just a cup of tea. Okay, well, it's a water extract, so I don't know if it was a tea. And they measured the milligrams so accurately that it might have been some kind of technical kind of infusion. Anyway, but how interesting is that? So that's basically anti-aging and also repairing after inflammation or any kind of assault on the tissues. Okay. So we'll move on to Icelandic moss, and this is a lichen. It's not actually a moss, and lichens are an indication of how pure the air and the environment is wherever they grow, and they virtually all have immune stimulating. This was an article which was concentrating on the immune stimulating role of lichen polysaccharides, and that's just one aspect of them. So it'll just keep scientists busy forever, finding out little small pockets of information, whereas historically we have long exposure and empirical observation, okay, and also observation over many different traditional systems. And what brought that home to me was Kew Gardens did an analysis of something like 20,000 different phylogenetic plants, so going right back to the gene origin. And then they looked at the constituents, and they aligned the constituents to herbs used for different conditions in 5 independent traditional medical systems, and found that the constituents were consistent throughout the 5. Like I'm talking about New Zealand was one, Nepal was another, Chinese herbal medicine, Ayurveda, and South African. So these were not linked geographically. They did not speak the same language. They had different culture and beliefs and traditions, but there was a remarkable consistency between the constituents looked at from a completely different examination system. So a phylogenetic scientific classification, which I thought was quite extraordinary. And the other thing that leads me to believe that these actual constituents and the combination of them is that primates know how to medicate themselves, even if they've never been taught, if they're not brought up in the family group or whatever. It seems to be an instinct, which makes it more likely that this co-evolutionary angle is quite important. Sorry, I do digress, but I hope it was interesting. So this is particularly because the lichens are a very primitive plant, so it goes back to our evolutionary background. And it's quite likely, as I say, that we dropped making these substances ourselves because they are available from plants, and the people got to know the plants. So what's the expression? Why do it for yourself when there's something else? Why do all the work when something or somebody else will do it for you? In that paper, it also pointed out that it's also been shown that polysaccharides isolated from seaweeds demonstrate immunomodulatory properties. And here we have our own favorite, carrageen. So I hope with anybody with asthma, allergies, infections, respiratory, immune, I'd encourage you to put carrageen in the diet. And I've mentioned ginger here, circulatory, diaphoretic, and digestive. And there's no research that I could find on a blend for the respiratory system, for a blend of herbs. And I was trying to find evidence for blends rather than for, in addition to the individual herbs. And this is a mouthwash with ginger, rosemary, and marigold. And there were significant improvements in all assessed efficacy measures. This actually was a very high spec design, randomized controlled, double blind, placebo, the lot. So a polyherbal mouthwash was safe and there was no adverse effects or dropouts, and significant, so clinically significant improvements in all of the measures that they affected. And of course, they would have been looking for antibacterial effects. This again, I found this article, which I thought was particularly relevant for you guys, because if you're looking for the effects of medicines, many of them overlap with those of foods. So free radicals, antioxidants, and functional foods, the impact on human health, because there's a lot of overlap between that and the herbs. The herbs are like a specialist medicinal end of the food spectrum with, as you know, a huge amount of overlap. And I'll do some of that. Now, in herbal practice, we also do a lot of looking after people with chronic or recurrent problems. So we do a fair bit of teaching and mentoring people about sinus friction rubs. And you can't tell because I think my cheeks are already warm because it's boiling in here. It's actually, wouldn't open the door. Oh, it is open, right, it's really warm. So friction rubs are where you use the two fingers in the middle and you rub quite hard. And immediately you can breathe better. And we use sinus friction rubs for that as well. We also use chest rubs. And some of these are available, but we do our own, so you're welcome to use those as well. We use essential oils. The ones that's readily available in the market is the olivos oil, Sinumed rinses, and postural drainage. And that's a system of drainage whereby people lie across the bed and read a book on the floor, right? And, so that they actually drain physically, because the sinuses the sinus drainage is designed for a still being on four legs. Just to say that all of these are as food supplements, both the chest and sinus and the mucotone. They're suitable for those not on medication. They're not suitable for people with complex structural immune or respiratory disease. You need to refer to a herbalist. Don't use any herbs with warfarin. And particular care is needed with immunostimulants, cancer, HIV, and antibiotics, particularly those for TB. So just to be aware. Refer to a local well-qualified herbalist. You want to find one that has a collaborative care model. If you can't find a local well-qualified herbalist that you can work with, we at Dr. Clare's Apothecary are happy to do Skype consultations. And we have a clinical herbal team approach. This is my colleague Lara Jónasdóttir, who's from Iceland, and she did her herbal medicine degree in Westminster University. She has a postgrad diploma in women's herbal medicine, and she's recently got a postgrad diploma in teaching clinical medicine in NUIG. And she is, as we speak, sweating over her master's thesis so that she'll have a master's in teaching clinical medicine. Oh, this should have gone before those, I think. The closest, again, I'm looking for research for blends of herbs. Sorry, this one's out of place. Sinupret is a proprietary formula with elder, sorrel, cowslip, verbena, and gentian. And several studies suggest that Sinupret may be effective in relieving symptoms of sinusitis. The herbs it contains may work by thinning mucus and helping the sinuses drain. They may also strengthen the immune system. And although we have some herbs in common with these, the overall principles, there are many herbs that have the same kinds of constituents like glycosides or polysaccharides or antioxidants or various other constituents, sesquiterpene, lactones, coumarins. But so what you're looking for is the blend that have been used traditionally that you're familiar with. So this is just a good example of a blend like the one that we have that it has been shown in studies to be helpful. And like the BronchoPret, which is a more simple one, which was shown to be as effective as the over-the-counter, or at least the over-the-counter synthetic herbs. This is a slide which is just showing you some of the herbs and where the research is at in terms of where the action is that they've established so far. So you might find that of use. I won't go through it in detail, it's there for you to mull over. So to help you manage your patients who are seeing you, who may have occasional or frequent problems with chest infections or flus or colds, use any of the herbs included in this presentation. Also in foods, and I'm sure you know this already, include turmeric, in soups, etc., carrageen seaweed. The convenience of what we have is that it's we can courier to people throughout the country, and it's the tincture and the tea, and we've previously been using the chest and sinus. From March, we'll be using the mucotone. And if any of you are interested in learning about herbal medicine, I've just put in there the connection for Heartwood that both myself and Lara are lecturing on. And what's very exciting is that for the first time in the 20 years that I've been working at home, as opposed to from London, and people can now do their clinical training in Ireland as well as the UK. So that's very exciting. World-class teachers, I mean, myself and Lara included, of course, but you know, you really are getting the best international. So you might have a friend who might want to study, or you might be interested yourself. So this is a bit about what things look like down in our end of the country. This is the retail area where we have all the blends and the teas. The products are available directly to patients if they telephone or go online. There's limited supplies to pharmacies and health food shops, and that might increase after March. Or if you want to buy 12 bottles of anything, and you want to make these available to patients yourself in the clinics, you can speak to Tara, and this is her the contact details as well. So do we have any questions? And thanks for your patience with our technical hiccups. Can people talk?
Hi, I was just wondering, are any of the herbs unsuitable for children?
We do have a children's blend, okay. Which is these ones are all for adults. It's just that there's a limitation to how much I can cover in 45 minutes. So yeah. rather than Tara's just going to get the ingredients for me. But so rather than doing 5 products, and if you go online, you'll see what else is available. But we also have a children's blend, and that can be used during pregnancy as well. Okay. So it's mallow, hyssop, I don't want to say it from my memory, just in case I say the wrong thing. Mallow, lime flower, elderflower, thyme and licorice, and they're all made as glycerites in water, so they're not alcoholic. The tinctures are in an alcohol base, but you're taking 5 mils 3 times a day. If somebody is an alcoholic, I always say to them so that they can make the choice. Okay. And if not, if they don't want to use a tincture, we have the cold and flu tea, and we also have a lung tea. So they can just phone the clinic and ask what we have available.
Okay, thank you. And
people, you can get your patients to just phone and ask if they have a query about something. Tara is beside me here, and she's a nutritionist, and she also works in the retail, in the dispensary. Great question, thanks.
Thank you.
I should also mention we also have an immune blend, which is very useful for people if they have low immunity for any reason, and they know that they're prone to infection, or they're recovering from the flu and they still feel like they can't shake off the symptoms. So, and also if you're surrounded by in an office full of people or a school full of people who are coughing and spluttering, I also take it if I'm going on any kind of long distance flight, and I usually have a bottle in my travel suitcase. The other way, a lot of people, they build up before they go on holiday and they get sick. So yeah, I'll pause for any more questions.
I have a question on the use of marshmallow root powder and slippery elm for someone with imbalanced gut flora or candida.
Oh, it's absolutely beautiful. In 20 years of practice, I think I've had 3 patients where it just didn't suit them. And the rest of gosh, how much slippery elm and mallow do we send out every week? Or we buy it by the 5 kilo, okay, just to give you an idea. It's absolutely brilliant for the kind of irritable bowel that goes between constipation and diarrhea, because they both act as prebiotics. They're both very nutritious food for those few millimeters lining the gut. The slippery elm is the bark of a tree, the inner bark of a tree. So it acts like blotting paper, but it's a very soft inner bark. So it also works like a very, very soft fiber. So it's very suitable for all for ulcerative colitis, Crohn's disease. And we do a blend of 50-50 slippery elm and marshmallow, which works even better than the marshmallow by itself. And for people with lung disorders or people with irritable bowel also have irritable bladder to some extent. So they're waking at night. They're not waking at night with their tummies. They're waking to go to the loo at night because the whole pelvic area is irritable because they're all served by the same nerve roots. So the slippery elm and mallow is also very useful for that. And slippery elm and mallow can be used in babies.
Okay.
I've got more and more babies and young people with reflux and digestive problems. Thanks for the question.
Thank you.
Hello, can I just ask just a quick question? Do you send your products out of Ireland? I mean, I live in France, so would you be able to send your product? Yeah.
Yeah.
Okay.
Yeah.
Do you have to order in a
Yeah, they go to France, yeah.
Do you have to order a certain quantity? Or, I mean, I'm not practicing yet, so
yeah,
it's for the future.
Yeah, if you speak to Tara, usually it's 12 bottles. Would that be about right? Or
it would be about right, but if you're just ordering for your own personal use, then you just go by the normal channels through the website.
Yeah.
Or if you want to make contact with me at tara@drclare.net, I can talk you through it.
Okay, thank you very much. And will we get a copy of this presentation? Because we missed the bit of it at the beginning.
Yeah, up on the NTOI website in the CPD section, it'll be up there and you'll be able to access it there.
Okay, thank you very much. Thank you.
Hello, I was wondering actually, do you cover such things as grapefruit seed extract and oregano oil? No.
We do have oregano supplements, but again, I just find using single herbs, it's a bit like a green bullet as opposed to the synergy that with which we've always traditionally used herbs. So I find for people with a very acute sinusitis, but that would be an awful lot less likely than using the herb blends.
Okay.
If somebody is in severe difficulty with very, very stubborn, and I really seriously think there's a very strong fungal element, but it's not, there's so much that I would do with food and herb blend tinctures, because if they haven't responded to antibiotics, and they haven't responded, you have to open up the blood circulation, you have to clear the debris, or no matter what you give them, it just won't hit the mark. Sinuses are, and I presume it's sinuses that you're using oregano for. You wouldn't really need it for the cold. You're much more likely to need that broad spectrum for the cold, or even flu. But oregano I would reserve for somebody with pneumonia, in addition to collaborative medicine. But I don't often use the oregano by itself.
Okay. Thank you. Actually, I was thinking more so of fungal dysbiosis or candida.
Yeah.
Thing.
I mean, I just do such a gentle approach with them because, again, if they haven't responded to 3 weeks of antifungal drugs, I don't see any reason why they would respond to a green bullet of very strong stuff. But, oh yeah, Tara is beside me. She's such a great right-hand woman here. We also do a Parasite Blend, which is more specifically designed for that.
Okay.
And that contains black walnut, thyme, marigold, wormwood, gentian, ginger, milk thistle, meadowsweet, peppermint. And it's the overlap of all of those. And you've seen from the research with the chest that an awful lot of those chest antimicrobials also cover fungi. And the beauty of that is that you don't get fungal infection just isolated from other parasites and bacteria. So if you deaden down the candida, if you haven't normalized the environment, which might be by nervines, it might be that they're so tense, it might be the vasovagal, the polyvagal vagus theory, where people have very low vagal tone, and that's the reason why. Because if you just add antimicrobials, you're just going to get a different distortion within the microflora.
Right.
Does that make sense?
Yes, it does actually. Yeah. Very interesting.
So the Parasite Blend, I find, is that gentle mix between all of those herbs are in a very small quantity. There's the milk thistle is there for liver support, and all of the detoxifying things that go on in there. Meadowsweet to soothe the stomach, gentian bitters for the vagal tone, peppermint for antispasmodic, and marigold and thyme and wormwood. They're my favorite antifungals. And the black walnut is specific to this blend because that's a little bit stronger again.
Right. Thank you very much.
You're very welcome.
Sorry, Dilis, can I just ask, in terms of the children's blend, is that a general all-round immune support, or is that chest and sinus? Or...
I mean, it's for the children's viral colds, snotty nose, fretful, uncomfortable. It encourages sweating. It soothes the digestion and the chest, and the hyssop is antispasmodic. And I would add in carrageen blancmange for them as well.
Okay, so I'm just trying to treat my own with his post-nasal drip and environmental allergies.
Oh, right.
Doing a gut healing protocol at the minute, but just in terms of trying to combat some of the environmental allergies as well.
Yeah, I don't have a specific blend for that. Like the blends are designed for the 65-70% of people with, mild to moderate. 85% of them are likely to respond very nicely with these. But if it's a persistent problem or children, why don't you work with Lara?
Okay.
And she can do a Skype consult with you. Children respond really, really well. And it can be very hard to treat our own family.
Yeah.
It's so difficult. So and Lara has 2 little ones, who are going through all of this herself. So you'll find a good ally.
Okay, perfect. Thanks a million.
Mine are all well grown up by now.
That's great. Yeah. Thank you.
Okay, we'll take one more question. Unless you've all gone shy. Is that it? All gone? Great. Okay, thank you, Tara.
Thank you, everybody, and
thanks
for
everybody.
your patience.
Yep. Bye now.
Thank you. Bye.
Bye.
Thank you. Bye-bye. Bye-bye.
Thank you.
Bye-bye.
Thank you.
Bye-bye. Oh, that was nice. They were very patient, weren't they? Yeah. Oh, teacher. The interaction is lovely. I like it when people can speak.
Yeah, that was which
was like, oh my God.